bandage in place, it will talk about how often to have those bandage changes done. The general rule of thumb with that is if we have an incision or if we have a wound of any kind underneath the bandage, splint, or cast, we're going to have to change that more often. One, so we can monitor that area, and two, we want to make sure we keep that area nice and healthy for healing. So if we have an incision or a wound present, we may be changing the bandage every 3 to 5 days. If we have a really significant wound, so your pet was in a hit by a car and has, large patches of damaged skin, we might even need to change it every 1 to 3 days. But on average, when there's an incision or a wound, it's every 3 to 5 days with bandage changing. And bandage changing should be done with a veterinary professional. Bandages have to be applied very specifically so that we don't have areas of increased pressure, areas that cause swelling, areas that cause other complications. So that should be performed with your veterinary team. Once the incision is healed and sutures are out, or if it's there's no wounds or any skin issues, oftentimes we can change those bandages every 5 to 7 days. The big thing with bandages is you want to keep them clean, dry, and in place. So if your pet has a bandage, we want to make sure that they're wearing that lampshade collar because we don't want licking or chewing at all. Moisture is the absolute worst thing for a bandage. So making sure you're wearing your little bootie or a covering when they're outside, that another pet in the household isn't licking on it either. Anything to keep it clean and dry. What happens when a bandage gets wet is if you've ever worn a Band-Aid and then washed your hands, and then your Band-Aid kind of stays wet, and then your skin kind of turns white and wrinkly and kind of weird underneath there. That same thing can happen underneath a bandage, but on a much larger scale. And we can actually get wounds that will develop, skin that will slough off, infections that will develop. Things can be very, very nasty under there if we have a bandage that's not cared for properly. So definitely follow your bandage care instructions to the letter. And if you have any questions, you'll contact your healthcare team. If there's any question as to how things are doing, if you have a funky smell that you're noticing, have the bandage changed sooner versus later. It's much better to err on the conservative side than to have to deal with the complication afterwards.